Assalamu alaikum wa rahmatullahi wa barakatuh, my dear brothers, sisters, viewers, friends of Iqra TV. Welcome to another edition of Real Talk. We had a discussion last week about health and Ramadan. Now I'm joined by Dr. Naeem, who's a GP in Batley. When he walked in, I realized he's my GP because we have a number of people who are known as Dr. Naeem and Khan, etc. He's not Dr. Naeem Khan, he's a Dr. Khalid Naeem. I wasn't sure he was the one who was going to come, but I'm really pleased that he's joined us here today. Dr. Saab, thank you for coming. Thank you for giving your time. We're talking about Ramadan and health issues that affect a lot of people in our community. We know for a fact that in our community we have certain diseases which are overrepresented in the population, such as diabetes, coronary care, blood pressure, etc., hypertension, etc., etc. And people are challenged when the month of Ramadan comes upon them. Some people are frightened as the impact on them that if they fast and they have to take medication, whether they should take the medication or they should fast. And Mufti Sahib made it very, very clear, and there's no doubt about it. It's completely black and white. You are required to fast, and unless and until you know that by not taking your medication you are likely to do harm to yourself, then you have to make sure that you fast. And if you know that you're going to harm yourself and put yourself in more danger, then there's gunjaish, there's facility for you not to fast. And there are two things you could do. You can either make up the fast once you recover, or you can pay fidya. Now we have the medical side of that, and we have Mufti Sahib. So obviously if there are any issues around continuing to look at what the fatwa and what Islam says, we'll have the guidance there. Dr. Sahib, thank you for coming. Thank you for giving your time. Now, as I say, we've been talking about Ramadan and fasting, and the discussion we were having was, if there's an individual who has got an illness, let's say particularly diabetes, which is very common unfortunately in our community, and people are on insulin or something like that, and they have to regularly take it, or somebody who's got a heart condition, who's got warfarin or blood thinning tablets, who are required to make sure that they take it at a particular time throughout the day. But the fast is so long that if they don't take it, it could have some adverse impact. What would your advice be to people like that? Because they are passionate, they are dedicated Muslims, they want to make sure they please Allah, and therefore they set aside the medication and say, no, I'm going to fast regardless of what happens. And they feel confident they can do it. What would you say to them? I'm sure you see that in your GP practice all the time.
Thanks very much for inviting me today. I'm not a mufti, and that's why we would need.
When I tell you on the medical side,
advice from Deen perspective, from fatwa perspective, that we would need advice from the scholars. But from the medical perspective, we categorize people into high risk and low risk.
Right.
And I would think that the category which would be in high risk, they should refrain from fasting unless they are too sure that they they're not going to be harmed. They have not had any significant effects of the medicine or not eating for a long time. In diabetes especially, people who are taking diabetes medication or medicines, some of those medicines can cause their sugar levels, blood sugar levels, to be below the critical level. Right. And if they are below critical level, then it's life-threatening risk.
Right.
And some of those medicines are in tablet form, some of those are injectable forms. The injectable forms people know of insulin, which is causing their blood sugar levels to come down within a normal limit. But if a person has not eaten for a period of time, insulin can actually cause their blood sugar levels to go critically low. And we call that hyperglycemia. And in that case, they need to have something to eat if their blood glucose go below critical level, and that means that they'll have to break their fast. If they're prepared to do that, then yes, they can take a risk of fasting But
So
in my
they
opinion,
can start a fast and then monitor themselves.
yeah,
And if they get to that level where they feel that, I'm feeling dizzy,
yeah.
I'm going to pass out, they can break their fast.
The other
And
risk
Mufti
in
Sahib, you say that is acceptable.
the other risk in this is that some people are aware of their hypoglycemia. Some people don't have awareness of their hypoglycemia.
Right.
They just collapse
Right.
before they know what's happened. And that is a risk which I would say for that person who is not aware of their hypoglycemia, they should not drive and they should not.
Right. They started the fast. They get to that level in the day, they feel that
they are able to fast. Discussion before, someone fasting would definitely cause them to be not fast,
Right.
and not okay with fasting. Attempts to the fast halfway through, midday, late afternoon, they feel that actually things are not going so great. They can break the fast,
Right.
and they should break the fast, and then just make the fast up after.
So Dr. Sahib, coming back, somebody, what sort of would you categorize as you talked about diabetes, for example. Other issues that are high risk factors?
The other one is, so some people situations
Right.
that their breathing get enough oxygen in them. Obstructive pulmonary disease is one of the known conditions where people lose in their lungs because of their profession, because of smoking, because of some previous illnesses. That they need to use inhalers at times when they feel like that. And from fatwa point of view, I'm not sure if taking an inhaler is not permitted in the state of fast, or if it's permitted, then probably they can take a risk. But if it's not permitted, then I would advise them not to. The other condition is heart failure, where people's heart is very weak, and they have to take certain medication at a certain point, and they can have some fluid accumulation in their lungs, and they need to be very careful if it's controlled, and if their medication falls outside the normal fast times, then they can take a risk, but it depends upon the degree of heart failure. The other one is ischemic heart disease, where people have got angina, or people have had heart attack, and then after heart attack they are still continuing to have symptoms of ischemia. Again, if their control is good, then fine. If their control is not good, they may have to take GTN spray frequently, and that is again a life-threatening risk, which I would.
Do you
think
find?
that
I
they need to
mean,
be
you have a
careful.
lot of patients. I know, because in the area that you work in, and there are a lot of people, who are willing to sacrifice their health sometimes because they're passionate about wanting to fast, pleasing Allah. Do you find that people put themselves at risk in those situations? Have you come across that?
Yes, people do. People do, because of the passion, and we should appreciate the passion. But I would think that our Allah has made our religion easier for us, and even we would find references in a hadith where Prophet Muhammad has advised the companions to make the religion easier for people, especially if somebody has got illness which can risk their life. Then I would think that it's something which should be permissible
Mufti
or is
Sahib made that clear,
permissible.
yes. So, people are risking their life, then there is facility for them not to fast and try and make it up later. If they're not likely to be able to make it up even later, then there's fidyas that they can give. But sometimes, as Mufti Sahib says, like his father, for example, and I know in my case, my parents, where they had illnesses, under normal circumstances they wouldn't fast, but when it comes to the month of Ramadan, they were so passionate about their faith. Now, do you think sometimes it's psychosomatic that people, because they're so passionate, that they feel that, Kudrati, there's a strength that comes into these individuals?
I would think that human body is very resilient.
Right.
That yes, people sometimes their body processes help them go through adversity, but still consciously thinking, scientifically thinking, I would think that rational decisions need to be made, and our religion promotes rationality, and then I think akal is extremely important in our religion, and we need to make decisions which are sound decisions for their health, for their survival, and for their duties.
Which is what Mufti Sahib and I had discussed in the first part of this program. But coming back to the more subtle issue about somebody who's got, like you say, breathing issues, asthma, etc., who need to take inhalers. Now, I know for a long time when I used to be asked, or people asked, we need to take blood from you. There was a school of thought which says, you can't even do that. The blood was, for example, you need to test the person. Ramzan to extract the blood, in itself is going to break your fast. Now, I'm still not clear whether that is true or not. Mufti Sahib, you may enlighten us, please, sir.
That is not true. Never has been.
Achha. But it's like, in my days, we were told, oh, no, you can't do that. Blood nahi de sakte bhai. You can't do that because you're extracting blood and therefore it's going to break your fast.
It's possibly something that's based on ignorance.
Yeah.
Otherwise, none of the scholars have that opinion.
So people, if the doctor calls you and says you need to give blood, you have to go and do it.
Yeah, you can take blood. Yeah.
What about inhalers, where people are taking, medication through their mouth? Because that's a critical thing about anything going down your mouth.
There are two opinions on that one.
Right.
My opinion is that if you are taking medication, inhaling medication, that will break the fast.
Right.
That tends to be the predominant opinion amongst the Indo-Pak scholars. And whereas maybe some amongst the Arab scholars, they may think that because it's going into the lungs rather than the digestive tract,
right,
that is why it doesn't break the fast. However, according to us, and the principle that I've seen across all the four schools, if it goes in, if something goes into the throat,
right,
that itself is a cavity of consequence. And when you put something of nutritional value into cavity of consequence, that break your fast.
Right. So, Dr. Sahib, I hope you get that answer. But I mean, you talked about angina, you talked about diabetes, you talked about breathing issues. Are there other issues where people need to be more cautious about their own health, that they need to be mindful of what they do in the month of Ramadan? Are there any other issues that you feel that people need to be aware of and more conscious about their health?
Yeah, not very many. I would say epilepsy is probably another condition where people may need, depending upon the frequency of their fits,
Right.
they may need extra assistance at times, and sometimes some of the medicines may need to be given to those people who suffer with epilepsy, so that it can be controlled.
Right.
So they need to make sure, if they are fasting, that they have got somebody with them, and that person knows what to give and how to position them to prevent any injury.
Now, one of the factors, in Ramadan, for example, is the gaps between the time when you can eat and when you can't eat. And in terms of medication, you normally you've got to take 3 tablets a day.
Yeah.
Right? So usually it's morning, lunchtime, and in the evening. As a medical practitioner, if somebody decides to take, I'll take one in Sahri time, I'll take one at Iftari time, so they'll skip the middle bit, and I'll compensate for that, for maybe later on after Tarawih, for example. Do you feel that is acceptable, or?
For some medicines, yes.
Right.
For some medicines, yes. How the dosage works is a medicine's half-life in the body. That the medicine, have its peak blood concentration at a point, and then it starts, clearing out through the metabolism and through the excretory system. So some of the medicines now, with advances in science, they've made in such a way that they are very slow release medicines. For example, there are now preparations for medicines which you may have to just take it twice a day. Some of them you just have to take it once a day, depending upon what sort of molecule it is, and that makes it easier for people who are fasting to take their medicine. And and for some of those medicines, which especially for diabetes medicine, if they are not eating during the day, probably just missing the middle dose can be fine, but they need to closely monitor their glucose levels. So especially if they are on insulin, and some other medicines like gliclazide, glimepiride, and dapagliflozin. There is a new set of medicine, SGLT2 medicines, which are also creating other risks, that if they have not eaten for some time, then it can cause something what we call ketosis.
Right.
And then that can be dangerous for our health as well. So they need to be careful.
So would you advise all your patients who are in that category with some of these symptoms and illnesses that they should come and consult you first or seek your guidance before they start the month of Ramadan?
Yeah. We have got diabetes specialist nurses working in our practices. Right. Okay. And they have gone on trainings where they know how to change a patient's medication in Ramadan.
All right. So there's special dispensation.
Yes.
So you've done this. All right, mashallah.
We've got doctors who have done certain courses to be specialists in diabetes management. Right. So they can also advise. And it would be better if people come and talk to them before Ramadan, so that they can have the diabetes review beforehand, and they can advise them about change of medication or whether it was suitable for them to fast or not to fast.
Oh, that's really interesting. I'm assuming that a lot of surgeries probably will have that service, or is it unique?
Especially in areas where
there's
a larger population of Muslims. Yes.
Right. All right.
Then there are online guidance available on certain conditions, especially diabetes, for Ramadan. British Islamic Medical Association has got a website which has got very nice flow charts to tell people which category they fall in and how they can be careful.
I mean, obviously that's something I wasn't aware of. You have this facility there as well. So anybody who's out there who is in, who unfortunately is suffering any of these illnesses or other illnesses that they know are likely to affect them in the month of Ramadan, you'd be better off first seeking medical advice before you decide one way or the other whether you're going to take a risk with your lives and also maybe put some other people's lives in difficulty as well. Well, these are obviously, Ramadan is a critical month, as you said. This is a month that Allah gives us to recharge our batteries, our iman, our faith, our spirituality. And obviously, as I say, a lot of people, despite some of the hardships, will still want to do that. They do that. And you asked the question about, how is it that some people can manage to go through it? I believe that Allah naturally gives us some strength in the month of Ramadan. There's no doubt about it in my mind. And I mean, this is one way of making sure that there's this one way of Allah saying to you, look, I'm going to give you the ability to do it. Now you prove to me you can do it. Right? I mean, is this my sort of weird thinking, or is that psychosomatic as well as I said?
First of all,
it's the strength of iman, isn't it?
First of all, answering that question directly, I'd also like to mention that British Islamic Medical Association, they have done some fantastic work.
Right.
And they have a paper on this, over 50, 60 sides, which talks about high risks, very high risk, and low risk, conditions, advice to doctors, etc. So I'm sure that Dr. Saab, that's what he's referring to. I have had a look at that, and it's actually quite good guidance. On the issue of, having some kind of special kind of strength that Allah subhanahu wa ta'ala gives, who knows? That's a very, subjective sort of, some understanding.
It's individuals, isn't it?
I can only talk about my father's experience, who, I would see and observe that he would fast the month of Ramadan and somehow he would get through it, apart from the last couple of years. Although he was on insulin for injected insulin. He controlled his diabetes, but he was on insulin for many years. But he was still fast, and I would keep an eye on him, and he would be like, oh no, he's okay. And alhamdulillah, Ramadan never had an issue.
Subhanallah.
So does Allah give a strength? Possibly. When
Gave him
Allah
a-
subhanahu wa ta'ala, when we strive, Allah subhanahu wa ta'ala can help us.
Ameen,
Can I
ameen.
guarantee that's going to be all the time? I can't do that.
I'm sure. No, that was not the question. The question was, does Gabi Madad aati hai just to give strength to
It can
individual?
happen.
Yeah.
But don't bank on it.
Yeah, you have to work for it.
Yes.
You have to work for it. You have to be a good Muslim throughout the whole year in order to benefit maybe in the month of Ramadan. My brothers and sisters, I hope what we've heard so far has been of real interest and value to you. I've certainly found a lot of good guidance there. We are going for a break now. Inshallah, we'll be back very soon with you. As I keep saying, enjoy yourself. Go and make yourself a cup of tea or a coffee or a faluda if that is what you enjoy. We'll be with you soon. Take care. Assalamu alaikum wa rahmatullahi wa barakatuh.